Hello friends, I'm Dr. Manish Madnani. I'm a gastrointestinal surgeon and I deal with variety of diseases which affect digestive tract. Let's talk about gallstones today. Gallstones are a very common problem. Worldwide data shows that around 6 to 7% of the population is affected by gallstones. That means 1 out of every 16% is affected by gallstone disease, and that data is actually alarming. Apart from that, developed countries harbor more risk of developing a gallstone, which is around 10 to 15%. So in the country we are living in UAE, the data actually it is not measured, but expected it to be 10 to 15%. That means 1 out of 8 to 10 persons should have gallstones. And not everybody out of this needs a treatment for that. That's what we are going to discuss today, gallstones and its treatment. Why the treatment is necessary, when it should be done, for whom it should be done, and how it should be done. Gallbladder is an organ which stores bile. It is not the organ which forms bile. Bile is formed in the liver. It is situated in the right side of the abdomen or tummy, below the liver, on the upper part of tummy. That is why when there is a stone inside the gallbladder and it is causing pain, it is felt most likely in that area. But beware, it is not the only area it can cause pain. It can cause pain between your shoulder blades. It can cause pain in the center part of the tummy. It can cause pain in the right shoulder and sometimes in variety of other locations. So that means the gallbladder pain is not always typical. But when it is typical and it is showing the signs of a complication, it needs treatment. What are gallstones? Gallstones are basically stones formed inside the gallbladder. Most of them are because of the cholesterol deposit. How do they form? Mainly, there are three mechanisms. One, the gallbladder is not pumping the bile itself. That is why the bile is static there. So, if we see the river versus the lake, the river water is flowing, and that is why the algae cannot form in that. Similar, lake water is static, the algae can form. Similar to that, the cholesterol, which is sticky material, and when it is excess in the bile, it forms stones, cholesterol stones inside the bile, inside the gallbladder. It can also form in the bile ducts also. But gallbladder is generally the most common site of arising of the gallstones. The second mechanism is basically the deposition of calcium along with the cholesterol or other pigments which can form the hard stones. Most of the gallstones are cholesterol stones and they are soft stones. The third mechanism is infection. Whenever there is infection inside the gallbladder, it will increase the chances of developing gallstones. Apart from that, weight loss, weight gain, hormones, female hormones especially, the fluctuation of hormones, and they all affect the motility of the gallbladder and they contribute to the gallstone formation. What is the function of the gallbladder? As I mentioned before, the gallbladder is just the storage organ. It stores bile. When we are fasting, that time the bile is not flowing directly in the intestines. The intestines have a mechanism where the bile is gated and then it can go back into the bile ducts and there it stores in the gallbladder and it is getting concentrated there. So when we are having a fatty meal or high calorie meal, it is released in the intestines and it helps in the digestion of the fatty meal especially. But when the gallbladder is not functioning properly, it cannot do this function. Most of the bile is throughout the day secreted in the intestines despite the gallbladder being there. Gallbladder's capacity of storing the bile is around 30 to 50 ml, while the bile formed inside the liver, which is more clear bile, more like a watery, it is generally secreted in the capacity of 800 to 1000 ml. That means 1 liter of bile produced every day, out of which the gallbladder stores only 30 to 50 ml of bile. That too, it empties 2 to 3 times a day when we are having our major meals. So when the gallbladder is removed, what is going to happen to this bile? It is going to secrete into the intestines by itself without any trouble. People also ask me, can I eat everything after I remove my gallbladder? Absolutely yes. As I mentioned, the gallbladder is just the storage organ of the bile. It is not the organ which forms bile. So when the gallbladder is removed, its function of storing the bile is taken care by the liver and the bile channels, which is called bile ducts. So that is why it is not affected. The digestion is not affected. In the long term, there are no disadvantages of removing a gallbladder. Versus if we keep the gallbladder which is not functioning well, it is having stones and can cause problem. The rate of complications is 2 to 10% every year. That means minimum 2, maximum 10 people out of 100 who are having symptomatic gallstones can land up in the emergency department with some complications. What are these complications? A simple pain. Apart from that, the inflammation of the gallbladder, which is called cholecystitis. When the stones can drop down in the bile ducts, it can cause major and significant complications like cholangitis, which is infection of the bile ducts. It can cause jaundice. It can cause pancreatitis, which is inflammation of the pancreas. These are more severe and serious complications of gallstones. They are pretty much preventable. The risk of not doing the treatment, as I mentioned, is 2 to 10% every year. But the risk of treatment, that means the surgery itself, removing the gallbladder completely, it only is risky in 0.1% of the cases. That means major significant complications can happen only in 1 out of 1,000 operations. Are there any medicines to dissolve the gallstones? And if there are, why not to try them? So basically, we need to understand these medications help in the patients who are not fit for surgery. Why? Patients who are fit for surgery will have to take these medications multiple times a day for the longer duration with their own side effects. Apart from the cost, we need to understand when the stones are dissolving, they are decreasing in size, they are more likely to drop down through the bile ducts and then can cause complications. That is the reason they are not used. Is there any herbal cure? Similar to the medicines which are available in modern science, there are certain herbal products which can help dissolve the gallstones, but they are not scientific. They can do more harm than the help, and they can also affect the other organs and your liver. The other questions people ask me is, why not remove just the stones? Why to remove the whole gallbladder? We generally give the example of kidney stones versus gallstones. In kidney stones, when the stones are formed, it is not the fault of the kidney. Kidney is a vital organ. We cannot live without kidney. Third, when the kidney stones comes out, they are coming out of the body through the urinary stream. While these stones can also lodge and can cause just pain or infection in the urinary stream. Similar to that, the gallstone can cause complication with pancreas, liver, and gallbladder itself. They are more tricky and risky. If I do not remove the gallbladder for a patient who is suffering from the gallstone disease, if we just remove the stones, they are definitely going to form the stones again. And that is the reason the gallbladder is always removed. The other reason when we have to cut open the gallbladder and remove the stones and then we just stitch it up, if the bile leaks from the gallbladder, it will cause more damage to the internal surface of the tummy, which is called peritoneum, which is called peritonitis. So that is why it is not advisable to just remove the gallstones. The gallbladder has to come out. And this is the standard treatment worldwide. So we need to understand this is not something non-scientific. It's a scientific treatment. It is a standard treatment, and the gold standard treatment is the laparoscopic surgery of the gallbladder to remove the gallbladder. How is it done? So that comes our next question. Laparoscopy. Laparoscopy is also called keyhole surgery, minimal invasive surgery. And how is it done? Inside the tummy, there is no space. The organs are near by each other. We put carbon dioxide gas inside through the tiny hole and then create a space where we can work. Now we don't have to put a major cut. We put small cuts, put the camera inside, and then our instruments go inside and do the job. This operation is done under full general anesthesia. Apart from that, this takes around somewhere 15 to 30 minutes on an average. In an elective cases, of course, challenging cases can take a lot more. Person needs to be in the hospital for one night for the observation. Few hours after surgery, liquids and the food is started. Patient can mobilize, they can walk normally, and they have to be actually moving. And after that, next day they can go home. It's pretty fast. At home, rest for 3-4 days is good enough to resume their normal activities. This is what is the post-operative care. In the pre-operative care, it is just like any another surgery where the fasting of 8 hours is required. Avoiding fatty meals till the operation is done is a good idea. After the surgery, they can resume their normal diet and even the fatty food within a couple of weeks. After 3 to 5 days, I generally allow my patients to have normal meals gradually. Will there be any scars? Of course, there will be scars, but they are very tiny. Scar related problems, wound related problems like infection, hernia formation, and scarring are very less in the laparoscopic surgery. One hole versus four holes. There is a variety of a laparoscopic surgery where the surgery can be done through a single hole, which is called single incision laparoscopic surgery, SILS. That is fairly possible, but it was my dissertation topic where we found that, and there are other papers also which found that with that the chance of injury to other organs is little bit high, very little, but it is still high. So that is why I do not offer the single incision laparoscopic surgery to my patients. I do offer them the standard of care evidence based medicine, which is a 4-hole standard laparoscopic surgery. Laparoscopic versus robotic, which is better? Both are equally good. We have to understand that they are just approaches for a patient. The same number of scars, same number of holes are there, and pretty much same. For the patient, the recovery and everything will be the same. But for a surgeon to do a challenging case, to do it at the comfort of sitting, while in laparoscopy, a surgeon has to stand and has to look up in the screen, the robot can be very much comfortable for an operating surgeon. It can provide more precision, more comfortable position, and ergonomics. But for the patient, laparoscopy versus robotic is almost similar. So if I have to choose laparoscopy versus robotic, given the resources, if I have the robot available and the patient is happy for that, robot can be done. I hope with all these questions answered, all your questions in mind regarding the gallstone problem are taken care of. If you have any further questions, you can contact us and we will be happy to help. Thank you so much.